Well, good afternoon, everyone, or good morning, depending on where you are joining us from today. Welcome to session 3 in our Implementing a Self-Measured Blood Pressure Program in the Clinic Setting Structured Collaborative. My name is Andrea Boucher. I am a Quality Improvement Advisor with Superior Health, and I'm excited to be joining you today to talk about SMBP devices. So before we jump into any of our content for today, just to go over a couple of housekeeping items. All of our sessions are recorded. Like I said, this is session 3 out of our 6-session series. So if you are unable to attend a session, we will send out the recording each month. We do want to make this interactive. So if you do have a camera, you can feel free to turn those on. Just remember to please mute yourself when you're not speaking. And like I said, let's make this interactive. So if you have any questions or comments, feel free to just jump in at any point with any of those. So we'll jump into introductions now. So we'll go through everyone who is participating in the collaborative today. So I'll have you share your name and title, your organization, and your location. And then if you remember from our last session, we did give you some homework to work on in between sessions. So those questions are listed out on this slide. A couple of the first ones are really around how you're getting blood pressure readings back from your patient population. And then the last few questions are going to be on if you choose to have a loaner program. So if you are not going to be doing a loaner program, you don't need to give a response to those questions. So I am just going to go through everyone how I see you on my screen. We'll start with our participants first, and then I'm going to have our Superior Health team introduce themselves as well. So Trisha, I actually see you first, so I'll have you share any updates that you have with us.
Okay, hold on one second, because I think you're hearing me. Okay, now I think you're hearing me through my headset. All right, Trisha Mayak with Inclusa, and where I'm residing is in central Wisconsin, Stevens Point area, but our organization has membership throughout the entire state. And my background is in nursing. I mentioned we have a couple people from our organization on. I see Stacy's on, so she can introduce herself when she's here. Tina is another individual. I indicated she's ill, so not on today. She'll follow up with the recording, but her background is in nursing as well, and we all work together within quality innovation and work on performance improvement projects. And then I'm not going into the questions yet, am I?
You can go into your, yeah.
Oh, okay. All right. And so because we all are from the same organization, so Stacy won't have to repeat this, but we did meet, actually was just yesterday, and because I had to reschedule us from last week, but we will be working with our IDT, which is our interdisciplinary team colleagues who are assigned to our membership, and work with them to develop how those readings do come back. We have to collect them anyway as a result of our assessment. Sorry if you can hear the dog barking. But we would also be working with them in a way of how does the primary care physician get the information as well. So we talked about that yesterday, and as we're doing this as a project, we would be really planning more in April and looking at implementing in May of this year, just so you're aware.
Okay, great.
And then because I think for some of the other ones we talked about is we'll always have a mode of being able to get feedback from our members, because we call them members versus patients. But the team, like I said, they have to be in monthly contact with the member. So we always have a connection as far as that communication. And then we just talked, our setting is different because we aren't a healthcare clinic or of such. So we are intended to kind of be like that holistic, all things care for the member. And in this case, we would be looking at supporting the member and being that communication with their primary care provider or us assisting in that. So based on what the member really needs support with. So I think that's the second bullet there. And then we would not have a loaner program because there's a lot of supplies that we have the opportunity to take in that we don't have the capacity to have, like a sanitizing, cleaning program, check-in, check-out program, but we are familiar that within our communities, there are a lot of loaner programs, so loan closets, and we really encourage our colleagues to maximize that. And then if there are donations that members have, to give to those places. So we would not have the loaner program ourselves, but we may encourage the use of a loaner program. Maybe not so much in a blood pressure piece. That might be something that we would authorize when there's a need for it. But that's how we work for other supplies, if you were interested in knowing that. We do utilize them within our communities. I think that's it.
Yeah, thanks for sharing, Trisha. Sounds like some really great updates, and look forward to hearing more about how your program kicks off in a couple months. Wonderful.
Yes, us too. Thank you.
All right. Ann Buchanan, I have you up next. And Ann, if you're talking, you are still on mute. All right, well, we'll circle back with Ann. Let's see, I see a couple of our Superior Health team. Kelly, I have you up next to share any of your updates.
Can you hear me?
Yes, we can hear you.
Okay, I'm sorry, I'm stuffing my face with lunch, so I'm gonna be off camera for a lot of it while I do that. But my name is Kelly DeLong, and I'm with the Muskegon YMCA. So I'm in West Michigan here. We do our blood pressure program both in person and virtually. The good thing about us being virtual is that we can serve people all throughout the state. But if people do want that in-person thing, we can serve kind of local here to West Michigan. So the way that we get the readings back from the patient is if it's on the Zoom during office hours, we can get it right from them there. Or if they're doing the in-person, we can get them there. And then our program coordinator is responsible for the documentation and the notification. And then same thing, it's just that real-time feedback to the patient. And then we don't actually do a loaner program. We thought it was really important that we went with grants that would provide a cost, because we want that self-monitoring to continue even after they're done with the program. And we wanted to be able to kind of remove that barrier and have that available to them. Happy to be here.
Yes, thank you so much for those updates, Kelly. All right, let's see. Oh, I see you now, Ann. Are you able to give any updates for your organization?
Yes, sorry, I had to step away for a second. So my name is Annie Buchman. I'm with the Oneida County Health Department, located in Oneida County, and specifically in Rhinelander, Wisconsin. Currently, right now, we have a blood pressure lending program that I have. 3 of my pharmacies are running it. So I have one is a grocery store that has one here in our area and one in the edge or the outskirts of our county. And then the other one is in the Rhinelander area. Both of them are community based. We started the program and I think the end of November, and it hadn't been taking off as we had anticipated. However, this past month or two, we've been doing a lot more education and pushing blood pressure checks and awarenesses, some of our free programs. And so it has been taking off pretty well. Prior to the blood pressure lending program, I was a pilot with the Pharmacy Society of Wisconsin and with our pharmacies, and we did, it was cardiovascular disease, blood pressure checks. And so we had the OMRUN 5 series. And so the pharmacies that are participating in the blood pressure lending program were a part of the other program. And they always use the Bluetooth portion of when the patients would come in. So they did the education piece of it. I had in my study, there was 15 patients that started the program. They had to come in for 6 months, 3 visits total every other month or every 6 weeks about. Every single one of them opted to come in person. And this was 2001 when this was happening. And then they got all the patient education. They got the MTM portion of it. And everything was on their monitor, but then it was also set up as Bluetooth. So, and that worked really well for that. So moving on to the blood pressure lending program. It's still in its beginning phases, and looking to expand it to 3 of our libraries that we have that are in the heart of our county and then surrounding the 2 edges that border up with 2 different counties. So that's kind of where we're at right now.
Yeah, that sounds interesting. Definitely a great way to get out into the community using those library settings. That's awesome. Thank you for sharing. All right, I have Stacy Maves up next. You can introduce yourself and give an update.
Yes, hi, I'm Stacy, and I'm also eating lunch, so I'm going to stay off camera. I am with Inclusa. I am an operations senior manager. I am a nurse by trade, though. And like Trisha said, we had met yesterday, and she shared the updates on kind of where we're hoping to take our program next. So thank you.
Great. Thanks for joining us, Stacy. All right. And lastly, for our participants, I have Shayna. Hopefully I pronounced your name right, Shayna Tierney.
Hi.
Welcome.
I will go on camera now that I'm done eating.
I know we're joining you over the lunch hour, so thank you all for being here.
Just trying to, oh, here, there. Start video. Anyway, it doesn't matter. Maybe, oh, there it is. So I missed the last meeting, but I'm more of a listener than anything. I guess I should start with clinical informatics. I'm a population health builder for it. So any of the registries that we have here at Olmsted Medical Center and organization, I kind of build all the inclusion rules and try to make sure that we're reporting back to the state appropriately. So located in Rochester, neighboring Mother Mayo, but the more cooler one, I guess. I don't know. So this is really good stuff. We just started doing, or we're in the process of doing, I can't remember what the vendor is because I'm not super involved in it, but it's one of those like they're going to do some remote patient monitoring for blood pressures. Athena, maybe? I don't remember for sure. But yeah, so more of a listener for a lot of stuff, but have lots of background.
Great. Well, thank you so much for joining us, and hopefully we have some good information that you can take away from today.
Yeah.
All right. Well, I think I covered all of our participants. Did I miss anybody? Okay. Well, for sake of time, our remaining people joining us are from our Superior Health team. So thank you so much for also being here with us today, but I'll go ahead and move into our content for today. Just a quick reminder on our collaborative schedule. So like I said, today is session 3. We do have 3 more sessions in our series. So they'll be on April 11th, May 9th, and June 13th. So hopefully you're also able to join us for those. Like I said, if not, they are recorded, so you will have access to all of that information. But like I said, our topic for today is going to be on SMBP devices. So we'll go over what, how these devices are clinically validated and where you can find information on those devices that are approved for SMBP. I'll also go over a return on investment. So if you do choose to move forward with a device loaner program, we'll go over how you can recoup those dollars as an investment into those devices. I'll also review a practice device accuracy test. It's a really great way to see if a patient's at-home device is giving you the appropriate readings as you're seeing in a clinical office setting. And then I'll go over the cleaning and disinfection process if you do choose to do a loaner program. All right, so starting out with the clinically validated devices, this is one really important aspect to making sure that patients' blood pressure readings are accurate and that they're valid, that these devices are validated for clinical accuracy. To address this, the American Medical Association came up with the US validated device listing, and it's available at validatebp.org. So any device that has gone through the rigorous testing to make sure that it is clinically validated has been placed on this list. So it's going through an independent process to determine which blood pressure devices meet those standards to be on the validated device listing, or VDL. So there are a couple of other lists available on this slide. Both the Canadian and UK lists were created prior to the US list. So these are just here for your reference. You can see what other devices may have been tested for accuracy, but might not have made it to the US list. Since this is somewhat of a newer resource for the US, those other listings are available here as well. And one other thing I did want to note is our CPT codes that are available for working with patients on SMBP. So these came out in January of 2020. So physicians can submit claims for 2 CPT codes when providing SMBP services. So that's going to be 99473 and 99474. So that first one, the 99473 code, this one is meant to be used when a patient is receiving the SMBP education and the training. That portion is going to be facilitated by the clinical staff, either the physician or a nurse, and really going over how to set up their blood pressure device to use at home, and then really how to take their measurements at home. As part of this, the measurement device should also be checked for clinical accuracy and also calibrated correctly. So this code can be submitted once per device. The reimbursement for this code is $11.19 for Medicare reimbursement. And it's most commonly used prior to initiating SMBP. If a patient does come in with a new device, obviously that device does need to be checked for clinical accuracy as well. So you can resubmit this code, but you want to make sure it's done at the beginning of SMBP prior to its initiation, so that you're making sure you're providing patients with the appropriate education. The second code is 99474. So this code is going to be used for the data collection for any readings that the patient is getting in their home setting, and also the interpretation of those blood pressure readings. So making sure that the patient is using that blood pressure device that was validated to measure their blood pressure. What they need to do is make sure that they're submitting their blood pressure readings, at least 2 readings daily. So how they would do this is 2 measurements, at least 1 minute apart, both in the morning and in the evening. And that to be reimbursed, a patient would need to submit a minimum of 12 readings within a 30-day period. So these SMBP measurements have to be communicated back to the physician's office, and those can be manually recorded, whether they were shared via phone or fax or in person, or if they're electronically captured. Let's just say there is a way that a patient can submit their readings through a portal, through an email, or if it's directly from that device. I know one of you mentioned Bluetooth devices. Those can have the potential to connect to an electronic health record. So if that connection was made, you can accept those readings that way. So either the physician or other healthcare professional has to create or modify, if this is a continuation, a treatment plan based on those readings that the patient submits back to them. So that treatment plan has to be documented in the medical record, and then also communicated back to the patient on what that plan is and how it may have been modified. So for that code, the reimbursement is $15.16. This can be submitted monthly for every patient that you are doing blood pressure monitoring at home for. So I did want to give just some data to give you a picture of how, I would say, underutilized those codes are throughout all of our region, the Michigan, Minnesota, and Wisconsin states. You can see that really there is not a ton of usage. There's only less than 100 for each CPT code out of the thousands of Medicare beneficiaries that could potentially benefit from this. So to be able to bill for that service, the patient does not actually have to have a diagnosis of hypertension. To do at-home monitoring, the patient it can be used for identifying a diagnosis of hypertension. So just want to say that there's a lot of opportunity for these codes to be used throughout our region. So wanted to point that out. And then this map is really showing hypertension prevalence data throughout our 3-state region. As you can see, the areas that have like the deeper color yellow are one of the higher areas of hypertension prevalence. And then obviously those red areas, there's not a ton of them, but a few counties and areas that have the highest hypertension prevalence. So that's going to be above 55% of that Medicare population that has a diagnosis of hypertension. So just demonstrating that there's definitely a need and an opportunity for SMBP to be utilized with these Medicare beneficiaries, and then also for those CPT codes to be used as well. So these next few slides I'll walk through is a return on investment. This is under the assumption that you would do a blood pressure device loaner program. And in this example, the device that is chosen is a Welch Allen 1700, and also having the option of an extra large cuff size for patients as well. So the approximate price for this device is around $100 and about $20 for that additional extra large cuff. So obviously not every patient needs that extra large cuff size. So I'm kind of under the assumption that for 15 devices, you can get 5 extra large cuff sizes that could be circulated through patients that might need them. So that total cost for that investment for all of the equipment would be around $1,600. So if you were to purchase these devices and then start working with patients on their SMBP and implementing these CPT codes for reimbursement, if you were to work with enrolling 15 new patients each month, this kind of demonstrates, obviously you submit that first code that I mentioned once per patient, providing them with their device accuracy check and that patient education. You do that once per patient, and then that continuous monitoring once monthly, you would recoup by month 7. You would have made your money back on that investment for these devices. Kind of a similar scenario, but enrolling 15 new patients, monitoring them for 7 months, it would take you 8 months to recoup your cost. A little bit less income that way, but still a way that you can kind of look at this scenario. And then also enrolling 15 new patients every 3 months. So as you're kind of circulating through a loaner program, getting new patients in every 3 months, you would recoup your cost by month 8 in this scenario as well. There's also a different example. Obviously, we know that there are many different devices out there that kind of range in cost. So if you're looking at kind of a lower price point in a device, this one is an example for the Omron 5 series at around $55. So if you were to invest in 15 devices, that total investment would be around $840. And then again, if you're enrolling 15 new patients every month, so you're under the assumption that, all of these patients would monitor, within that first month and then return their devices, you could recoup your cost by month 5 of a program. And then if you enrolled 15 new patients and then continued monitoring them for 7 months, you would recoup that cost by month 4. So a couple of different scenarios and examples for you just to kind of see that loaner programs can be beneficial. I definitely understand that there are some patients that would benefit from continuous monitoring, but if you're using this in the scenario where maybe you want to identify a patient with who might have white coat hypertension or masked hypertension, this is a great way to see if that is a scenario for that patient, or if they just need to monitor for a brief period of time. This is a good opportunity to use a loaner program. So the next section I'm going to go over is a device accuracy test. So this resource was developed by the American Medical Association and American Heart Association as part of their Target BP program. And this is really helpful in looking at a patient's at-home device and the readings that are achieved with that device versus an in-office device. So how these How this test works is that a total of 5 measurements are taken. 3 are taken with the patient's device, and then 2 are taken with an office device. So with that, you take those 5 measurements, you make note of the systolic blood pressure from the results of those readings, and you would document them in the device accuracy test. So step 2 is to look at a couple of averages. So the averages of measurements B and D, those are both averaging 2 patient device measurements. So once you get that average, you would compare that average to the measurement C, which is your first office device reading. If there's a difference between these readings that's less than 5 millimeters of mercury, then that device, the patient's device, is going to be appropriate to use for SMBP. If it's between 6 and 10, you want to go into the next step and look at those additional readings that you had taken. And then if it's greater than 10, then it's just not an appropriate device, and you want to make sure you replace that device, or the patient replaces it, before continuing to monitor their device with that, or monitor their readings with that device. Or if you had that between 6 and 10 range going into step 3, again, you're looking at averaging C and E, which are those office readings, and then comparing it to that last patient reading, those systolic readings. If there's a difference that is less than 10 or equal to it, then you can use that device for SMBP. And then if it's greater, again, replacing it, or have the patient replace that device. So this is a great way to test out patients' devices to make sure that they are appropriate for use. All right, so the next section I'm going to cover is on infection prevention. So it's really important to understand the difference between cleaning a blood pressure device and disinfecting it. This is really helpful in protecting the longevity of your devices, and then also being able to safely provide and clean those devices and provide them to your patients. So cleaning is the removal of any visible soil, whether that's organic or inorganic material, and removing that from the surface of the device. So that's normally accomplished by either manually or mechanically using water with detergents or enzymatic products. So just to note that this does not kill the germs, it just removes them. Disinfection, on the other hand, is the process that eliminates many or all of those microorganisms, with the exception of bacterial spores. For example, C. diff would be an example of that. Really, the ideal process is to do cleaning and disinfecting, so that you make sure that you're not only just removing the surface, the pathogens from the surface, but also killing any residual pathogens that may be on the surface of those devices. So these are some guidelines that the CDC has put out as far as disinfection to prevent COVID or cross-contamination of devices. So there's 2 different types of surfaces that we wanted to point out here. The first one being the hard or the non-porous surfaces. So the process for this is to wear disposable gloves when you are cleaning and disinfecting these types of surfaces. Make sure you wash your hands prior to donning gloves, and discard those gloves after you are done with each cleaning. I will say, to point out, the manufacturer's instructions should provide you some guidance on how to clean any specific devices and what products should be used to do that. But if there is not, there's some guidance that we can provide as far as some general cleaning guidance. But you want to make sure that you clean the dirty surfaces using detergent or soap and water prior to disinfection. Again, consult that manufacturer's guidance on how to clean the blood pressure cuff and also the tubing pieces of the device. For the electronic portion, obviously this is like the screen. If you're using a digital blood pressure device, which most at-home devices have that electronic component, make sure that you're following the manufacturer's instructions for cleaning and disinfecting. You can use wipeable covers that could be placed on the product for all electronic pieces. If there is not any manufacturer guidance available to you, what could be done is alcohol-based wipes or a spray that have at least 70% alcohol that makes sure it's disinfecting and killing all of those residual pathogens. And then after you are done with that cleaning and disinfecting process, make sure that those dry surfaces are, you're drying the surfaces to make sure you're avoiding any pooling of liquids, because that could cause some damage to your devices. So if you choose to move forward with a device loaner program, it's really important to have a process in place for cleaning and disinfecting to make sure that those devices are ready for redistribution. So one thing that we suggest is having color-coded bins. It's a great visual representation for you to see where your devices are at in your cleaning and disinfecting process. So you could have your green bin, which means that your devices are clean, they are ready for distribution. Those could be any new devices that have not been sent out to patients or loaned out to patients yet, or devices that have been returned by the patient, they have been disinfected and have met that minimum of a 96-hour hold before being redistributed. The yellow bin is your observation bin. Those are devices that are placed on hold. They've been through that cleaning and disinfecting process, but they do need to just be sitting for a minimum of 96 hours before being sent out again. And then the red bin is your intake bin. So those are any devices that are coming back from the patient that is requiring disinfection. So you want to place those in a protective bag as you're receiving those back from the patient, so that there's no kind of cross-contamination if you have multiple devices sitting in the red intake bin, and that the person disinfecting those devices is responsible for cleaning and disinfecting the entire area where those monitors are being processed. This slide shows an example of a log that can be used for a loaner program. So you would assign device IDs to all of your loaner devices, and providing information for what patients are checking those out, their contact information, what date it has been sent out, and which team member was responsible for the distribution of that device, and then when it is due back to the office, and then leaving a spot for the return date. So when that device was returned to the office, and if it was placed in that protective bag, and then lastly, going through that cleaning and disinfecting process, if it's been completed or not. This slide shows a process that you could walk through, like I said, going through those color-coded bins. So as your patients are enrolling in SMBP, a device can be taken from your green bin, because those are ready for distribution and ready to be used by the patient. The team member can fill out that device inventory form from the last slide that I just showed. The patient would take home the device and be able to use that for whatever period of time has been noted in their chart. After they bring their device back to the office, if there's not a team member that's currently available to clean and disinfect that device, it would go into the red bin to be cleaned later. Once a care team member has that availability, it goes through that cleaning and disinfecting process based on those device guidelines. The care team member would place that device in the plastic bag and note the date and time on that bag and in the inventory log. And then the care team member would place the bag in the yellow bin, so allowing for that 96-hour hold time after that cleaning and disinfecting process. Once that's been done, it can again be logged into the device inventory management tracker. That 96-hour hold would happen, and remove it from the yellow bin and then placing it in the green bin for redistribution. So this is just an example of what that process looks like in a visual flow chart. Real quickly, just wanted to note, these are references in case you are curious about any cleaning or disinfecting. That's where a lot of these sources came from. So just these will be available to you as we link you to the slides. But what we'll have you do next, again, we have about 1 month in between each of our sessions. So we will have action planning for you to do before our next session. So what we want you to think about is what your process is going to look like for those device accuracy tests. So a couple of things that you can do is if you are doing a loaner program, you can test the device in advance with staff and set them aside so that you have an inventory of your devices that are ready to loan, ready to go out and give to patients. Or you can test those devices if they are coming from the patient, if they're purchasing them themselves. You can do that at the point of care with the patient. So if you do choose option A, you can start on this now. You can work on developing that loaner program and creating that inventory of your devices. I would suggest doing like a lunch and learn with your staff to teach them how to do that device accuracy test and just really walk through that with the devices that you have, and then also the office devices that are available to you. So that way it will just be a real quick education on how they can do that actually in the point of care with the patient. So what we'd like for you to think about again is what that process might look like for you. It might look different if you do have that loaner program, or if patients are going to be purchasing or supplying their own devices. So that would be done at the point of care. So that's what we would love for you to think about over the next month or so. But at this point, I know that was pretty quick and a little bit of information that we put out at you. So I'll open it up if anyone has any questions or comments. And feel free to unmute and ask a question, or you can put it in chat.
Andrew, I have a question.
Sure, go ahead.
So this machine right here, it's a Welsh Allen, and it's like on a wheels and everything, and it's got the bigger cup, whatever. I had bought 3 of these like in 2019, and those are the ones that you usually have like at your doctor's office. I have all the size cuffs and everything like that. So this February through work, I was doing just a fun little program for our employees on getting your blood pressure checks. And I had some of my nurses were doing checks. And of course I was the first one to go, which is fine. She did mine, and my blood pressure was like 150 over 80 or something. And I'm normally 110 over maybe 70 tops. So we just chalked it up. It's just, I have an issue. Okay. So then we moved on, and then 3 to 4 employees after all registered high. So we have declared that this device, is not accurate. I called the manufacturer that we ordered it from on it. Unfortunately, it's no longer in existence. They have now since upgraded it, and they don't even have the manual to send me. So I tried to search honestly on my own. But in the meantime, we tried to like calibrate it against, I have some Omron 5 series and a couple other in-house ones, and it still is off by 10 plus points. My question is, how do I continue to test the bad one first versus, continuing to validate it? Will it eventually go back because and we've never really used it? It's been on a shelf or on a pole. And then the other ones that we have are perfectly fine. There's nothing wrong with them. Same make and model, ordered, everything shipped at the same time. Just your thoughts on that.
Yeah, I think that's a great question. It is recommended to have devices checked if they are like an automated device, like the one that you have, at least once per year. If you are continuously seeing those readings that are off, I would suggest discontinuing the use of that device. I would also suggest if you can compare the readings that you're getting on that device with a manual method of getting readings, because that can give you a little bit more accuracy as well. That would be my recommendation. And especially if there is no device manual that is available for that device. It might just be time to maybe update and get a different one. I would suggest they also have not just at-home devices on that validatebp.org website. There's also office devices, like any kind of blood pressure device that is recommended for use is available on that resource. So that would be where I would suggest to kind of start to look at what devices might be best to use.
Yeah, and I did see that Welsh Allen, they do the cups are all the same. It's just the monitor itself it's no longer on there. And we did look at the automated versus the manual on here. And that also did fluctuate just a teeny bit, but 5 of us would be considered high blood pressure.
Yeah.
So we all need to, have some intervention at work otherwise, if that's the case.
Yeah, that's a great question. I definitely recommend checking that. Sometimes even like every 6 months to check that devices are still giving an accurate reading. Same thing goes for manual methods too, to make sure that all of the components of those, those pieces are working as well. That would be my suggestion.
And once it's, I guess, deemed that it's not valid, how do you dispose of it? Or is there somewhere that it can go to be refurbished? Or, you know what I mean? Is there some use somebody can have of that?
I'm not quite sure about. I think there's a way, like I know some cities or organizations offer like electronic recycling. So that might be an option. I'm not sure about the tubing and all components of that, but I would say the electronic portion can probably be recycled during one of those kind of events.
Okay. Thank you.
Yeah. Any other questions, comments anyone has for today? Feel free to put them in chat, or you can unmute and ask a question. All right, well, not hearing any additional questions. I did just want to point out that all of the resources, the slides and recordings from today's session and our previous sessions are available to you on our Superior Health Connect page. There is a specific page for this group. So all of that information is on there, and we have the link to that directly to this group on these slides as well, and we'll share that in chat. Just wanted to wrap up today with a couple of reminders as well. We do have our Back to Baseline and Beyond webinar series. A couple of these topics are definitely relevant and on the topic of hypertension, which I think is helpful for this group, especially. Our March 21st session is going to be on cardiac rehab. We'll have some great patient stories during that session. In April, we'll be taking a look back at our year in review, since it's been a year since we've been hosting this series. And then in May, we'll be talking about the importance of hypertension control and stroke awareness. So hopefully you're able to join us for that series. We also have some other great resources available for you on Superior Health Connect. Our Food First, Using Food as Medicine course is available on there. A lot of great resources for your patients are on there. So this is another great resource that you can provide to your patients as they're working on an SMBP program. Just another great lifestyle management resources. And our Shine a Light on Stigma campaign is still progressing and going strong. So if you have not yet taken the pledge, we encourage you to do so. This is surrounding substance use disorders and really trying to, stop the stigma that many individuals might have around substance use disorder, and how we can really become more aware of how those words and the language that we use impact others and impact the feelings related to substance use disorder. So again, if you haven't signed the pledge yet, please go ahead and do so. And with that, that is all that we have for today. We have our link for today's slides and our Connect group in the chat. And then we'd also love to hear your feedback through the evaluation. So thank you, Carrie, for putting those in chat. So please take a moment and let us know how you think these sessions are going. But with that, if there's no other questions or comments, I think we'll go ahead and wrap up today. So thank you so much for joining us, and we will see you next month. Thanks, everybody.